Welcome back. Now, prostate cancer is the second most diagnosed cancer in men. Here in Ireland, it's excluding skin cancer. So after receiving surgery for prostate cancer, our next guest experienced incontinence, which greatly impacted his daily life.
Now, joining us to share his experience is Gerry Connolly, alongside cancer awareness nurse Michelle Lonergan. Good morning,
morning to you both.
Morning. Gerry, thank you so much for coming in and talking about this morning. Can we start with your diagnosis and how you found out about your diagnosis? Because you just went to your GP, what was it, with a persistent cold?
Yeah, just a persistent cold back in 2013. And at that time he said to me that the HSE were implementing a new policy of men of my age to do a PSA test through a blood test. Yeah. And the PSA test is a prostate-specific antigen test, and it was just a simple test. We did the test, and the results came back a few weeks later that my prostate was raised, which is, mine was 6.5. I think, Michelle, is it 4?
Yeah, so it varies really, I suppose, from men to men, depending on the age as well.
Yeah, the elevated levels within the blood test. So you go with the cold and you end up being diagnosed with prostate cancer a few months later.
Yeah.
Gerry, how was that?
I suppose at the time when I went to the doctor, I never heard tell of prostate. I never heard tell of a PSA test. It was all new to me.
Yeah.
But you were slowly getting educated as the months went past, you know. So what we did do at the time was, his suggestion was that we monitor it for a while. I went for a biopsy, and the biopsy came back clear. So you were then in the system. So you were back every 6 months monitored. Yeah. And I came back then maybe 6 months later, and again it stayed raised. So I was referred back to the clinic in Galway, and I had a second biopsy done, and then that's when it came back then that you were positive for prostate cancer. So I suppose in your head, through that journey, you were probably thinking at some stage that you were going to face up to this, and I would be fairly positive type of a person. So I just said, right, let's deal with this, and we looked at the different options. When I went to Galway, then I looked at the different options. We sat down and we looked at either radium operation, or there was another form called brachytherapy. So I sat down with my family when I came home, and we sat down and we talked about it, and I made a decision. I don't know whether I was right at the time, but I was self-employed at the time, and if you were going for the radium treatment, it could take 6 weeks up and down to Galway. And I obviously thought, well, if I went for the operation, that I could get this over a lot quicker and could get back to work, you know, which was probably the first mistake that I made, because you just think you're going to get back to work afterwards. But so that the operation was
to have your prostate removed.
The prostate was removed. Yeah. They at the time then they had an arrangement with the Galway clinic. The Galway clinic had this robotic machine then called the Da Vinci machine. And if you were a candidate, which I was under 60, I wasn't overweight, so they said you could be a candidate to go forward for this. So they put me forward, and I was accepted. So the operation itself was very less intrusive than an ordinary operation. So recovery time was very, very good. So I think I was in Galway for about 5 days and back home again, and then that's when the incontinence hit you with a...
And were you told that might happen?
It was urinary incontinence.
Yeah. Well, at the time you were up and down to Galway, and you were meeting anaesthetists and bone scan and all that. And now they did have a discussion about this, because you were maybe up for some to see a specialist or something, and they would say there's a talk upstairs afterwards about they talk about the side effects. I call it the after effects, because they're there with you. And it was discussed, but you were sitting in a room where there might have been 10 other men, and they were talking about incontinence. I never experienced incontinence, and I was thinking, must be for these older men that are here they're talking about, you know. Right. So,
and Michelle, would that something that would be a side effect with this type of prostate cancer?
Yeah, so we know, even, you know, statistics will tell us that over half of men that receive life-saving treatment for prostate cancer, be that surgery, sometimes radiotherapy, can experience urinary incontinence as an after effect, as you say, Gerry. And sometimes it can be very temporary, and other times it can be more long term. And it's caused because, you know, there's damage done to the nerves and the muscles during treatment. And I suppose, as you said, Gerry, you're told about it, but often you don't. You're kind of getting through your treatment.
Yes.
You're thinking, I'm getting over my surgery, I'm getting on to the next stage.
Of course.
You're not really taking all that information in.
Yeah.
And then other times it is brushed over, you know.
Because I suppose it's something, so many of us know people who have had prostate cancer, but I just didn't know about the urinary incontinence, that this was something that could come with it. So this was your life, Gerry, when this happened to you. And that's I can only imagine. Like, it's a huge change.
Oh, it's a massive change, because I don't think you're ever prepared for it. Even you did go to the talks, you're not really prepared, because you have basically no control over your bladder movement.
Yeah.
And I remember when I left Galway, they gave me the sumo pants, as I call them, the sumo wrestler pants, for keeping the incontinence in. And I think I had maybe 10 of them with me leaving. And I got a prescription, and I was told, you know, go to your chemist with a prescription. So I went to the chemist on, I think it was a Thursday, went to the chemist, gave him the prescription. Gerry, we don't have any of these. We'll not have them until Monday. That's no problem. Have you got something similar? We give you a pad. We give you a pad that's some similar size.
So you can show us some things.
You have some of the stuff here. So these are.
This is my vein. This is my vein here. This is what I call the sumo pants.
Right.
And this is what this is the ones that you'll get now in the chemist anywhere.
Yeah.
But the ones that come from the hospital are larger, so they're bulkier.
Right.
And that I went through. I think for the 2 days I was home, I went through about maybe 6 of them a day.
6 a day.
6 a day. The chemist didn't have them in then to the following Monday, so I ended up with this size of a pad here. Then, this was the size of a pad I was wearing then.
So you're just constantly changing.
You were constantly changing them, and then what happened?
It's like the big old, you know, women's pads. The sanitary towels.
Yeah,
is what this one here.
So what happened to me then was I think about the second or third day I went to bed. I had none of these left, so put this on, went to bed. About 2:30 in the morning, waking up sort of very uncomfortable in the bed, discovered wet the whole bed.
So you need that type of one.
I needed that, and that severe incontinence lasted for about 6 weeks. So you were basically in these for about 6 weeks.
6 weeks.
And this is where
just to be wearing that then, and when you're out and about, and like obviously you in your mindset was going, I can't do that. I can't go there because of this.
No,
that will have to be changed.
One of the things you do is you just don't think about going out, because number one, your confidence is knocked.
Yeah.
You're still dealing with the fact that you have no control of your bladder. Yeah. You're afraid of leaks. And then the other thing is, when you have these pants on you, you know, if you're going into a gents' toilets, it's all right when you're taking this off. You just tear down the side. But then you have to remember, I have to put a fresh one on, so you have to take your trousers down, your shoes off.
And then how do you dispose of that?
Well, you're sitting with that then, and I was at the stage where I would have been taking a bin bag with me, and you're folding this up.
So
rolling it up and putting it into a bin bag.
I
taking
suppose
it home with you.
For periods, you know, we're used to having our bins, our sanitary bins. Thank God, in the toilets, you know, we've got ways around all these things. But this is a campaign that you're involved with now. That it's Dispose With Dignity. That's what it's called.
It's more to give men a bit of comfort and dignity when they're out and get out, because, as I say, in a way, it kind of affects your mental health a wee bit, because you lack confidence. You don't want to go anywhere. You know, I had family coming up to me or calling to the house to see me after the operation. We're saying, "Oh, sure, you'll be off now for a couple of weeks now. Sure, take her on up to our house." And I said, "Oh, no, I'm just not going anywhere." You know, and they couldn't understand why you weren't. And you were going through this yourself.
Yeah.
But the one thing you didn't realise, that looking back on the whole campaign now, that my wife Rose was going through this with me, and my family.
Yeah.
Everybody was going through it. But it's happening to you, so, you know, she would even have seen, she was telling me she's seen a change in me. I was grumpier, I was you know, frustrated, you know, all that sort of thing came into it, you know. But the campaign now of trying to get this into toilets now and cubicles.
You've got one here. It's like a sanitary bin that women will know full
like
well. It's just a little toilet. We'll get a shot of it here. Derek's going to get a shot of it there, Gerry. So it's just something that you want people to be more aware of, to get these into bins, because it is the second most prevalent cancer in men in the country. So there's so many people going through this.
There is.
That's it, yeah. And the statistics are, you know, 1 in 6 men in Ireland will get a prostate cancer diagnosis. Now, obviously, there's all different levels of it, and not every man will have experienced urinary incontinence. But that said, it is even the awareness of it, and even myself and Gerry were chatting, even seeing the bins in the toilet might be enough to start a conversation. So for men who aren't going through it, you know, you see it and you think, I wonder what that's about. And you might go home and say to somebody, you know, look what I noticed in the toilet.
And what was that for, and what was that thing?
And it might be enough to prompt a conversation amongst men, because we do know that men are less likely to talk about this. Of course,
and it's like you were saying, Gerry, it's affecting you. So I think when you open up about it, when you talk about it, the relief then that you can start moving on with your life.
Oh, you can.
How
because,
are you now?
I mean, you, as I say, you progress from this then to a bigger pad, and then eventually down to, you know, once your incontinence does settle down. Some men it does clear, but for myself, it never cleared. So you progress down to a smaller pad, and it's it's manageable. It is manageable. You have to get.
And how are you now?
I'm fine now. I'm still working. It's 10 years ago since I had it done. I have 6 grandkids. I have 2 daughter-in-laws since that. You know that I never thought I would have had if I hadn't ever went for that PSA test.
Just that test.
You wanted to do this. Thank you so much for coming in and talking about this. We see these in women's loos all the time. It's no big deal having a sanitary bin in men's ethers. It is the Dispose With Dignity campaign. If you want to find out more, you can find out more online. Gerry Connolly, prostate cancer survivor, who is doing this Dispose With Dignity campaign, and Michelle Lonergan, cancer awareness nurse. Thank you so much for joining us.
Thanks. And can I just say that, you know, support is out there for men as well. And we have a support line that cancer nurses will take your call. 1-800 200 700, and it's really important, I suppose, to know that service is there.
And we will have all that information on our socials as well for people that can.
Brilliant, thank you.
Thanks so much.